Hi, my name is Dana Dayton, and I'm a 53-year-old mom and wife and full-time worker. I live in Alexandria, Virginia, and I have three kids. And I am so lucky to be sitting here right now because about 10 years ago, I was diagnosed with stage 4 esophageal cancer. I've been through multiple rounds of chemo, radiation, and an esophagectomy, immunotherapy, and other treatments. And I am very grateful for the fact that I'm sitting here. It wasn't the story that was supposed to happen, but it's the story that I get to tell. And I feel very blessed that I'm able to work with the Esophageal Cancer Action Network to help provide resources and information about the disease so that other people might be able to survive too. A lot of people ask me how I know I had esophageal cancer. I actually didn't know for a really long time, and it turned out to be quite the diagnostic journey. When I was 42 or 43, I knew I wasn't feeling well. I had a lot of joint symptoms, severe pain, and just an overall malaise. And I started seeing different physicians. It seemed pretty certain that what I was presenting with was lupus. And that seemed bad enough. I wasn't very happy about that. I had three young kids and a full-time job, and I was already feeling the effects of um, not being well. I could barely keep my eyes open at so many different parts of the day. I couldn't keep up with my kids. They put me on hydroxychloroquine, which is a standard treatment for lupus, and it actually started to help. But the interesting thing was it was a very short-term benefit. And about 4 to 6 months later, I started having sort of the same terrible feelings, but even more. And I started to have discomfort around my midsection. And the more we explored that with different types of biopsies and different blood panels and things like that, it was very clear that I had a malignancy, but it was not clear what kind. And the diagnostic journey continued. A lot of the specialists that I saw were pretty sure that it was a GYN cancer. Some thought it was a breast cancer or a brain cancer. And that is because all of the markers from all of the different biopsies between my neck and my abdomen all pointed to different things. The very last test that I did was an endoscopy, and that's what revealed the true source of the malignancy. So that's when we knew it was stage 4. It had already metastasized to different parts of my body, and it was in my lymph nodes, and it definitely explained why I was feeling pretty awful. But interestingly enough, I did not have any of the normal telltale signs of esophageal cancer. I did not have any trouble swallowing. I did not have any heartburn or indigestion. I just had these other vague, nondescript symptoms.